Okay. Yeah. Lady Wolf Pack on a whole nother level. Savage as they come, gang of female rebel. We got the sharpest claws, we got the whitest teeth. We coming for your lunch, but we only bring the heat.
Hey y'all, I'm Cassidy, the favorite daughter, obviously.
And I'm Kim, her mom, her match, and the real reason she turned out halfway decent.
Welcome to Mom's Favorite, the podcast where we laugh, vent, and overshare like it's our full-time job.
Yeah. And we're coming straight to you from Austin, Texas, where the queso's hot, the opinions are hotter, and we don't sugarcoat a damn thing.
Just think of us as Thelma and Louise, but only they're related and they have a podcast instead of a death wish.
So go ahead and pour yourself something strong, maybe a margarita, get a little snack.
Because here on Mom's Favorite, we got a lot to unpack. Well, I'm flying solo again today, MFers. And you can think of this as sort of a second installment of my Tales from a Former L&D Nurse episode a couple weeks ago. But today is going to be a little different because I'm not really telling stories. I'm going to be reacting and breaking down a specific episode from a TV show. Specifically, Season 1, Episode 11 of The Pitt. Now, since we're all about favorites around here, I have to admit TV is one of mine. Especially medical dramas, guilty pleasure. But any person who works in medicine will tell you that those shows are wildly inaccurate. Grey's Anatomy, I'm looking at you. But The Pitt, honestly, one of the most accurate medical shows I've ever seen. Well, MFers, I'm flying solo again today. And you can think of this as sort of a second installment of my Tales from a Former L&D Nurse episode that I did a couple weeks ago. Today's a little bit different though because I'm not just telling stories, I'm going to be reacting and breaking down a episode from a TV show. Specifically, The Pitt, Season 1, Episode 11, because it is a birth scene. And now, since we're all about favorites around here, I have to admit that TV is one of my favorite things. Especially medical dramas, guilty pleasure. And any medical professional knows and will tell you that those shows are so wildly inaccurate. Grey's Anatomy, I'm looking at you. But The Pitt, honestly, it's the most accurate medical show I've ever seen. If you have not yet watched The Pitt, I highly, highly suggest it. It's on HBO. If you work in the medical field, you're not going to roll your eyes because, like I said, it's very accurate. And if you're not in the medical field, but you want to know what it's really like, you need to watch it too. It is great. It is almost perfect. All of it's pretty spot on between the abbreviations they use, the way they communicate with each other, the tests that they order. It's all pretty much perfect, except for the birth scene, of course. So today, I'm going to break down exactly what they got wrong, what they nailed, and how it would really go down in the real world. Let's scrub in. Nothing infuriates me more than watching a birth scene on TV or in movies because it's always so wrong. I mean, they rarely get anything right. And that baffles me because the staff, production, cast members, there has got to be several women working on this that have delivered a baby. And so how can no one catch some of this crazy stuff that they get wrong. Like, for example, the fetal monitor being placed on the outside of the gown. I've seen that, not on the Pitt, just some other show. Or just crazy stuff like that. It is just wild. Also, I know several L&D nurses, myself included, that would love to get paid to be a medical advisor on shows like this to make sure that they get stuff right. I mean, I would be happy to assist. So if anyone's looking. Okay, back to the Pitt. If you haven't watched it yet, what are you doing? It's amazing. But also, I'm going to kind of spoil an episode if you care about that kind of thing. So here's your warning. Okay, so like I said, it's season 1, episode 11. And, you know, in true ADHD fashion, I'm probably going to explain way too much, but I feel the need. Okay. So essentially, the part I'm going to be talking about is a scene that depicts an OB emergency or an obstetrical emergency. And kind of a backstory, not that it really applies to my issues with this scene at all, but it's a woman who is a surrogate for a same-sex couple, and she comes into the ER in active labor, and she's wheeled in, and the first thing she says is, "I'm fine, really, it's not my first time." And you can see that, you know, she's a little, definitely uncomfy because she's all sweaty, but she's not screaming or climbing off the bed or out of control in any way. So in this show, the first thing they do is they take her into a trauma room for a check, quote unquote, with a plan to send her up to labor and delivery. So here's the first. No ER in any hospital would willingly bring a full-term pregnant woman who's obviously in labor to a room to check her. If she appears stable, meaning she's conscious, she's not bleeding out, there's not a baby actively coming out of her body, and she does not have any other acute injuries like head trauma or bones protruding, then she would immediately be shipped up to L&D with haste. Because ER nurses and all the people down in their ER are very afraid of pregnant women, especially ones in labor, and they will do anything to avoid delivering a woman in the ER at all costs. And then they asked Dr. King, who I believe is a first-year resident, to check the patient. So she lifts up the blanket and sticks her head underneath. Stop. That killed me. And then they do show like a fake vagina with a baby head starting to show, which I will admit does look pretty believable, though they definitely could have used some more like mucus, blood. And then one of the doctors telling her not to push, which is silly. Because anyone who's had a baby unmedicated before knows that there's no not pushing. When it gets to a certain point, your body is going to just start pushing on its own. It is something called the fetal ejection reflex. And so whether you're ready or not, or the ER is ready or not, a baby's going to come if it's going to come. So then they offer this patient, well, we can try to ship you up to L&D, but you risk delivering in the ER. Or we could just deliver you right here in the ER. Again, never gonna happen. And then they say, call up to L&D and tell them this baby's coming now. Which, in the event of an imminent delivery that physically will not make it up to L&D, in the real world, they call an alert overhead on the intercom. And everyone's kind of trained on what to do in these scenarios. my hospital, we call it a code stork. And we even do drills. So like if they call a code stork, specific people know to go down to the ER. There's a big bag of supplies we grab. NICU automatically comes down there too. They have all their equipment for the baby. And this patient specifically definitely would have had time to make it up to L&D. Now, people that work in the ER love them, don't want to do what they do, but they tend to freak out a little bit. Like I said, they don't like pregnant people, especially people in labor. And so a lot of times when a code stork is called, we run down to the ER with a couple of L&D nurses, an OB, NICU nurses, like I said, and a lot of the times the patient will be like only 6 centimeters or something, and then we'll take them upstairs and they'll not deliver for a couple of hours, but the ER nurses or ER resident will be like, she's about to deliver, just like a little bit panic mode, which is why this episode was so funny, because all these doctors were just willing to do everything they could to deliver this baby in the ER. So this is a bit of a sidebar. One time, a hospital that I worked at, a patient came into the ER and delivered her baby in the breezeway of the ER in front of the security desk. And this baby fell out of her basically while she was standing up, and the umbilical cord snapped and the baby hit the floor. And then the mom and baby were bleeding everywhere because the cord is supposed to be clamped on both sides, mom's side and baby side, before it's cut. And so these poor ER people were frantically trying to clamp the cord, and for obvious reasons, they were totally traumatized. And so, then every pregnant person, or could possibly be pregnant person, they would be like, immediately, no. Don't even come through the door. Just go upstairs. So yeah, they probably needed therapy after that. Okay, so back to the Pitt. Now that they've got her all tucked into the trauma room for her delivery, they have her start pushing, and the head delivers normally, but then she's continuing to push, and the baby's shoulders aren't coming out, which is indicative of something called a shoulder dystocia. So this is what happens when the baby's shoulder that's pointing up towards the sky kind of gets hooked up under the woman's pubic bone. And so in this case, you cannot and should not continue to push, because you risk damage to the nerves in the baby's neck and arm, which can be permanent and quite debilitating. If you've ever heard something called Erb's palsy, that's what that is. And this can happen without a shoulder dystocia. It's just way more common in that scenario because of the excess stretching of those nerves. But in the show, the doctors do recognize it's a shoulder dystocia, and they mention something called a turtle sign, which it is a thing that does happen with shoulder dystocia, but they said it was happening at the wrong time, after the head was already out, and that happens before the head is out, like when they're crowning, but I digress. So they recognize a shoulder dystocia, and Dr. Ravi, who is Noah Wiley's character, asks someone to call L&D to bring down a fetal monitor, which, first of all, she could have been up in L&D a long time ago, and we wouldn't be where we are, but they already called them prior, saying they had an imminent delivery. And so, in real life, after that first call, the whole team would already be down there with all their supplies, monitors, and would probably have already whisked the patient back upstairs. But at this point in a delivery, a fetal monitor is pretty useless. It's not going to change the management of this patient either way. The baby needs to come out. That's the goal, ASAP. And also the baby's basically in the vagina. So trying to find the baby's heart rate externally would be very difficult. And I could pretty much guarantee that this baby's heart rate would be pretty low, or bradycardic as we call it, because it's getting squeezed in the birth canal. And it's also only halfway out. Its head is out. And so that means that the umbilical cord is sort of being compressed between the baby's like shoulders, neck, and the mom's vagina. And so this is why a shoulder dystocia is considered an emergency, like pants on fire emergency. Even with a shoulder dystocia, ideally you would like less than 3 minutes between delivery of the head and the rest of the body. And even that is long. And L&D nurses will tell you 1 minute in a shoulder dystocia feels like 27 minutes. But when you get to 5, 6, 7 minutes and the baby's still not fully delivered, you're already on your way to the operating room to perform life-saving measures, because the baby's brain has been deprived of oxygen, and the longer it takes to deliver, the more risk you have of brain damage or even death. And this is where, this episode of the Pitt really got me, because anyone who's been in a shoulder dystocia, whether they're a nurse, a patient, family member, they will know that it is scary and stressful, and there's definitely a sense of urgency in the room. And this scene, they were way too relaxed to depict a true shoulder dystocia. Even Dr. Robbie says, "There's nothing to worry about. We'll just try something else on the next push." No, you should all be worried. It is time to panic. So once a shoulder dystocia is recognized, there's a series of maneuvers that delivery providers are trained to use in a specific order in an effort to free that upper shoulder from under the pubic bone and get baby delivered. The first of which is called McRoberts maneuver, and that's where you lower the head of the bed so that the patient is completely flat. Then you have the patient flex her knees up towards her ears. And this kind of creates more room in the pelvis to hopefully, make more room for that shoulder to be freed. And in the show, they have this patient just like sitting straight up in the bed. She's basically sitting on her baby's head, if that's how she really was going to be positioned. And so there's no way they'd be able to resolve a shoulder dystocia in this position. And for this kind of patient in particular, since she doesn't have an epidural, you could also flip them over into hands and knees position, kind of the same idea. It creates more space in the pelvis and kind of utilizes gravity to help free that shoulder. So yeah, they do McRoberts maneuver, but they're doing it wrong. And then they do move on to what's called suprapubic pressure, which is what our next maneuver would be. And that's where you kind of use your fist to apply strong pressure just right above the pubic bone, and basically trying to like push the baby's shoulder down and out from the outside. So they do that, and they do call it suprapubic pressure, but again, the patient is sitting straight up, and so there's no way you could do this maneuver correctly. You have to be able to get your fist like up in there, not up in there, but in that area, the suprapubic area, right above the pubic bone. And if you're sitting straight up and you are pregnant, your belly's just like blocking it. So that was not it. Then they kind of move on and do the other maneuvers, which were pretty accurate. And then the baby delivers. And obviously the baby's stunned because its head was born for 3 minutes before the rest of it was born. So they take the baby to the warmer, and they do some resuscitative measures, which again were not quite accurate, but that's neither here nor there. I'll leave that for another episode. And they did a better job. You can never make a newborn baby on TV look super believable, because unless someone wants to give birth like on screen. So they use like a little animatronic baby, which it looked pretty real. It was better than some other ones I've seen where they come out like 3 months old already, or they come out and they have like goo and blood all over them, except like a perfect circles around their eyes. So they did a pretty good job. And then the patient goes on to have a postpartum hemorrhage, which is pretty accurate. Having a shoulder dystocia does increase your risk of hemorrhaging. And, that one, they managed pretty well. They did use all the right meds and pronounce them right. So I gave them points for that. But the urgency that they had for the hemorrhage should have been the urgency that they had for the shoulder dystocia. It kind of should have been reversed. A shoulder dystocia is more pants on fire emergency, and hemorrhage is more urgent, but we have a lot of things we can do. And they did give the meds, but then they started talking about hysterectomy like way too soon. There was a lot more things that they could have done before moving on to that option, but they stopped the bleeding and everybody was fine. Blah blah blah, happy ending. But I will say, like, this whole time, this entire scene, nobody from L&D came down, except an OB came down way late. And the way they depicted this OB was horrendous. They made this OB look like a straight up idiot. And I'm kind of mad about that, because OBs are super smart. They have to be. I mean, they manage pregnancies and everything during pregnancy, even if it's not pregnancy specific, because no other doctor is really comfortable treating pregnant patients. They technically have to think about 2 patients, the mom and the baby. And they're also surgeons, and these aren't simple surgeries. They're really complex abdominal surgeries. And so I think they should have given OBs way more credit than they did. I mean, this OB came down and like didn't do anything, just kind of stood there and was like, okay, I'm going to go back upstairs to postpartum. Like, any OB can say that if, you're walking into a known 3-minute shoulder dystocia and postpartum hemorrhage, you're going to be like kicking people out of the way to get up in there and do your job. Because like in the show, they have this ER doctor, well, I think she's like a 3rd-year resident, putting in a Bakri balloon, which is a balloon device they use for postpartum hemorrhage. And there's no way an ER doctor would know how / want to put in a Bakri balloon. And so it's just nuts to me that there was nobody from L&D up there, down there, or wherever they are. Nobody from L&D showed up. The OB was like completely useless, and all these doctors and residents in the ER just magically knew how to do all the L&D procedures and were like super willing and wanting to, which is just funny because like in real life, they call it a code stork, or we come down for a delivery. Like the minute we get there, they're like, oh, thank God. And they like scatter like cockroaches. So yeah, that was not so accurate, but I do love the show and everything else is pretty great. I mean, as far as I know, I mean, I don't and never have worked in the ER. And so there's probably other things that were like not real life. But as far as I know, it's all pretty accurate. And I know that they, some of the actors were like actual nurses and stuff. So that's really cool. And I'm happy that they, actually put in some effort to get it accurate. And I know Noah Wiley's mom was a nurse. So that was cool. When I learned that, I was like, oh. But I just thought it might be interesting to kind of talk about that episode, from the POV of an actual L&D nurse. And if you guys like it, I could try to kind of make it a series where I watch different episodes from different shows or movies, birth scenes, and kind of break them down and talk about why they're totally bullshit or what kind of stuff they got right. And I also kind of hope that I could teach you guys a little something if you didn't already know. Teach you guys about, delivery and what's normal and what happens in an emergency and all that kind of fun stuff. But I really appreciate you guys joining me for this quick little episode today, and we will be back next week with more craziness. Thanks for hanging out with me. If you like this episode, please follow and leave a review, and go to our Instagram and give us all the hearts. We would love that. So until we meet again, MFers, go watch the Pitt. You will not be sorry. And message me or text me what you think after you watch it. And remember, the next time you see a birth scene on TV or in a movie, somewhere out there, an L&D nurse is yelling, "That's not how any of this works." Later, bitches.